bet a lot of you, when you go outside for the day or get in your car, you automatically stick on your sunglasses. Well, why are you doing that? Are you doing that because the sun is bothering your eyes? Are you doing that because when you're outside, you're just suffering so much discomfort that you can't function without them? Well, I'm here to tell you that you might have a vitamin A deficiency. So today we're going to talk about vitamin A. What does it do for you? What are your symptoms if you're deficient in it? And where do you find it? How can you take more? And what type to take? So in my last video I talked about the importance of self-diagnosis. So when you're learning today about vitamin A, I want you to think, do I have these symptoms? Are these problems that I have? Because you might have a vitamin A deficiency. Let's take a look at exactly what vitamin A does. Vitamin A aids in the growth and repair of damaged tissue. It maintains the health of your eyes, ears, bones, skin, and mucous membranes. Vitamin A fights and prevents infections, including infections of the kidney, eyes, middle ear, sinuses, intestines, ovaries, uterus, and lungs. It aids in your body's ability to produce antibodies and white blood cells. It also has antioxidant properties that neutralize free radicals in the body that cause tissue and cellular damage. A vitamin A deficiency ranges, of course, from mild to severe. When looking to see if you have a deficiency of vitamin A, always look to your eyes. See, whenever you look at light, vitamin A is being used. A good analogy I like to use when thinking about vitamin A is film inside of a film camera. When you take a picture, you expose the film to light, and then that film is used up. Well, the same thing goes with A. Whenever you expose your eyes to light, you're using up the vitamin A. So if you can't go outside without wearing sunglasses because your eyes feel uncomfortable in the sunlight, then it's possible that you may need some vitamin A. So someone with a semi-mild deficiency may believe that they see more efficiently in the day, but not so well at night. Even now, as I'm standing outside, my body and my eyes are processing vitamin A. Staring at computer screens, reading books, all of these activities that involve a bright, shiny surface or extra light being projected into your eyes is using vitamin A. So if you do these activities a lot, you might have a vitamin A deficiency. So someone with a mild deficiency, you may experience eye fatigue after watching television or any bright surface for prolonged periods of time. Have you ever been outside on a really bright and sunny day and then come inside and your eyes have a hard time to adjust? If it takes way too long for your eyes to adjust from daytime to nighttime or from light to dark, then it's possible you may have a vitamin A deficiency. A semi-moderate deficiency, you'll experience pain in your eyes, especially after long use. You may start experiencing nervousness, headaches, and visual fatigue. An even larger deficiency creates eye strain and a difficulty to drive at night, creating night blindness. You may require dark glasses to wear during the day if you're having discomfort in bright sunlight. Moderate deficiency can cause discomfort and eye strain, and you may refuse to drive at night. You may require dark glasses during the day. Night blindness is one of the first and foremost symptoms, and you can easily correct it and regain your night vision back. Someone with proper levels of vitamin A have no problem moving into light into dark, light into dark. So if you are having a problem with this, then you may want to get tested for a vitamin A deficiency. When lack becomes severe, you may experience burning, itching, and inflamed eyelids, eye strain, severe pain in your eyeballs, or frequently occurring styes, nervousness and exhaustion. Mucus may accumulate in the corner of your eyes. Ulcers or sores may appear on the covering of the eye or cornea. A vitamin A deficiency can lead to eventual blindness if not corrected. A vitamin A deficiency can also affect your skin, causing something called follicular hyperkeratosis. And that occurs when the lower layers of your skin start to become dry and flake off. This causes the dry skin to start clogging your pores, causing kind of a goosebump feeling on the back of your upper arms, thighs, buttocks. This drying of the skin can also lead to the clogging of your pores on your face and can lead to acne. So if you are experiencing acne, vitamin A deficiency might be the cause of it. And check this out. If you or your spouse is suffering from overly stinky armpits or feet, they may have a vitamin A deficiency. It's the vitamin A that keeps your skin moist and rich. Without it, your skin starts to dry, and that dry skin starts to collect, and bacteria is having a feast on it. And the more bacteria, the stinkier your feet are going to get. So keep that vitamin A up. So the symptoms that affect your skin are dry skin, follicular hyperkeratosis, if you have acne, and stinky feet. A vitamin A deficiency causes your hair to become dry and lack luster and shine. It can also cause dandruff. You'll develop ridges in your nails and peeling nails. Your mucous membrane line body cavities such as your nose, your throat, your lungs, your middle ears, your urinary tract, and your gallbladder. What the mucous membrane does is it's constantly secreting a fluid so bacteria cannot attack these areas in your body. When you're lacking in vitamin A, it tends to dry up. Bacteria can't survive in mucus. So when you're lacking in vitamin A, bacteria has a chance to attack all of these areas and start breeding like crazy. And the last thing you want is your body to be attacked by the bacteria that's already present but not attacking you because you have such a healthy vitamin A-filled mucous membrane. Vitamin A is also important in developing your bones and tooth enamel, also an extremely effective infection fighter. Your susceptibility to infectious diseases skyrockets when your body is not fully supplied with vitamin A. If uncorrected, you have a high susceptibility to infectious diseases, especially respiratory, kidney, eyes, middle ear, sinus, intestines, ovaries, uterus, and your other lady parts. Dry skin, rough skin, weight loss, poor bone growth, weak tooth enamel, diarrhea, slow growth, acne, insomnia, and fatigue are all symptoms of a vitamin A deficiency. Vitamin A usually comes from an animal food source, such as liver, egg yolk, cheeses, and milk. But you can also get beta-carotene, which your body converts into vitamin A. It's found in all kinds of plants, green leafy vegetables, and any sort of vegetable that has a orange or yellow pigment. I provided a list of foods that provide vitamin A in the info tab, and you can take a look. The dose varies from person to person. If you're someone who spends a lot of time on a computer, or a lot of time outside, or a lot of time skiing on the slopes, then you're going to need more vitamin A than someone who spends more time in the dark. So keep that in mind when taking your vitamin A. According to Adelle Davis, the recommended dose is about 50,000 units per day should suffice. Now, to correct mild eye symptoms, you can take about 50,000 to 100,000 units, and you'll notice a difference about an hour after taking it. If the deficiency is more severe and you're taking small dosage, it could take 2 weeks to a month to clear up night blindness. And correcting skin problems can be fixed within about 2 weeks after regularly taking vitamin A. Vitamin A is a fat-soluble vitamin, meaning that it is stored in your fat and in your liver when you're not using it. So there is a possibility that you can OD on these things, but if you're already showing signs of deficiency, the likelihood of that is low. And if you're taking the right doses, it's even lower. So there are other vitamins you can take that interact with vitamin A to make it more effective and for your body to easily absorb it. Another key to using a fat-soluble vitamin is that you need fat in order for it to work. So it's important that you get a little bit of fat in your diet so that you can actually process this vitamin. It's important that you have proper levels of vitamin E as well as vitamin A when you are supplementing. Also, taking zinc with vitamin A will make it more effective. There are also some things that counteract the absorption of vitamin A. Antacids, for example, will prevent the absorption of vitamin A. Drinking alcohol will prevent the absorption of vitamin A. If you are experiencing toxic symptoms of overdose of vitamin A, you can beef up on your vitamin C and it will correct the overdose. Diabetics often have abnormally low levels of vitamin A in their system, so you may want to beef up on that too if you have diabetes. So thanks for watching and learning about vitamin A with me. If you have any questions, then please leave me a comment or send me an email. And definitely please subscribe because I'm going to be going over each vitamin with a fine-tooth comb so you can know as much as you can about them. So I'm your Living Now life coach, and remember, now is the most important time of your life. Have a great day.